another session. So I'll be presenting my presentation, Exploring the Cornea Chronicles. If anything that COVID has taught us, it is to move away from the human cornea, because the availability can go down at any point. So this is a new artificial cornea that has come into being, endo-art, and this is not a far-fetched dream, I must say, because it is already being used in L.V. Prasad Eye Institute. So this is an artificial cornea. The main purpose of this is to prevent the imbibition of the fluid in a Fuchs dystrophy or a failed graft. So the surgical process is fairly simple. But unlike a human cornea, you can actually touch this artificial cornea because you're not destroying any endothelial cells. And the only surgical step which is different from a desec that we do is a single suture that is put at the 12 o'clock. And long-term studies have shown that this is quite reliable, and the studies have already started in India as well. The second artificial cornea that is available is Xenia. This is used in keratoconus. This can be implanted in the intrastromal layer of the cornea. Femtosecond laser is used to create the stromal pocket, just like in a smile surgery, and this particular lenticule, Xenia, can be inserted in this intrastromal pocket that is created, and this brings about corneal stabilization and visual improvement. And it is also already being used in India as well in the study stage. So to get rid of both the corneal implants altogether, we now have the injection of cultured corneal endothelial cells. This is being exclusively propagated by the Kyoto group by Kinoshita et al. So this is a small surgery where the cells, the endothelial cells can be taken from a normal individual, cultured, and according to the reports, it can be used can be injected in up to 300 individuals with endothelial dysfunction. And the requirement after the injection is that the patient needs to maintain a head down position, so these endothelial cells actually stick to the endothelium, cultured endothelial cells. And long-term reports, they have been publishing their 5-year follow-up reports as well. And what is interesting is that the endothelial cell density, which tends to fall after a DMEC or a DSEC surgery, they compared the outcomes of just an injection with the the fall in endothelial cell density over a period of time, and they have reported that it is comparable. So the 5-year follow-up of endothelial cell density is much similar to a surgery, so this could be a game changer. The other new advent, and we need to be proud that this is by an Indian ophthalmologist, by Dr. Susan Jacob, is the customized CARES. So this is a keratoconus topography with storing an inferior steepening. We have already know what does CARES do. So it just flattens the area of steepening. So now Dr. Susan Jacob has come up with a way to customize this by making segments such that in the area of maximum steepening, the segment is thicker, and where there is lesser steepening, the segment is thinner. This is a small video showing that. This is how it's prepared from a normal corneal structure. Then this is the normogram that they use to customize it. I mean, this is the diagram that they use. A normogram has not yet been released by the CARES group. And then they customize it, and then they make a thinner segment for the lesser steepening area, and the insertion is fairly similar to the intacts that we use. And they have published that they do have good results coming out with it. So topical losartan eye drops is available in the Western countries now. So this inhibits the tumor growth factor beta, which is involved in the myofibroblast formation. So this is not commercially available. So pure losartan powdered is actually compounded with a balanced salt solution, and the recommended dose is 0.8 milligram, and this is used 6 times a day for 4 to 6 months. There is no reported toxicity, but it is quite expensive. It's available in the Western countries, and they have reported a good decrease in the corneal fibrosis haze in many conditions, including post-PRK. So insulin has played a vital role, and now there is topical insulin eye drops that can be prepared. Dr. Saji Hussain does have a video on YouTube. You can go check it out on how to prepare an insulin eye drop. So it acts as an insulin growth factor, and it plays a vital role in wound healing and regulating the cell growth and proliferation. And it also is known to make the corneal sensitivity recover. So it is a great adjuvant that you can give along with your lubricants for a neurotrophic ulcer. So the recent entry into the market is definitely the Seca drops. I'm sure all of you have heard about it. And the Opus 1, 2, 3 trials have established the safety of these drops. So these can be, these are act in controlling the ocular surface inflammation in dry eye mainly, and they can be given, they are prescribed 2 times a day. The advantage over cyclosporin is that they do not need any refrigeration. The only limiting factor probably is the cost. It is slightly more expensive. It started off in around 13,000 to 15,000 for the drops, but now the company has actually reduced it to around 2,500 is what I've heard. And this is a study published in the Indian Journal of Ophthalmology, which has shown beneficial for dry eye patients. This is my favorite update, I could say. So this is a rose Bengal mediated photodynamic, like a cross-linking therapy for corneal ulcers, which has been already propagated. So in the cross-linking that we use the riboflavin, but this is a rose Bengal mediated, and the light source that is used is slightly different, and it is propagated for mainly corneal ulcers of 300 micron thickness, and the reactive oxygen species generated is known to kill these organisms. It has been reported to be more favorable in Fusarium species than the Aspergillus species, but this is an interesting update to watch out for in the future. And also the corneal dystrophy classification has been released this year. There are minor changes. I would say I have read it a couple of times, but still it takes multiple readings to actually register everything. But do have a look at it. There are slight changes in the ICD classification, and Pentacam in this year ESCRS released their anti-segment OCT. So we all know that Pentacam has the corneal topographer, but they also released their anti-segment OCT this year, and look at the magnificent images that it gives. It has a fantastic resolution, 1.9 microns, so you can actually see the Bowman's membrane and the scar, and these are the beautiful pictures that they released. I'm not sure if anybody has it in India yet. I think the NN group has it, but it's a fantastic machine. Yeah. Thank you very much for your patient listening.